Caron got involved in research a very long time ago. We initially focused in on outcomes, which is so important and should continue. However, we decided to go the route of medical research rather than psychosocial research. The reason we went to medical research is to give that objectivity that is so necessary in our field. We need to find out how we can predict relapse, how we can predict who is going to be addicted if exposed to certain medications. We need to find out what elements are necessary to prevent relapse. These are all research projects that we have going on currently.
One area of opportunity that was identified by the NIH was the idea of repurposing medications. So the idea is that you would take a medication that's already been approved by the FDA and use it to treat another condition. So for example, our suvorexant study. Suvorexant is a sleep medication, also known as Belsomra, and it's been approved for use for sleep disorders. We know that insomnia is a significant risk factor for relapse. So the idea is that if we can help patients to sleep better, help them to overcome their insomnia, might we be able to help them prevent relapse? One study that's looks at whether or not we can look at a patient's genetic profile and based on that determine whether or not they have a high risk or a low risk of developing an opioid use disorder. And that could potentially have a significant impact, because if we are able to identify that certain patients have a high risk of developing opioid use disorders, then we probably shouldn't be giving them opioids when they have surgery or when they have chronic pain.
We use neuroimaging studies in the form of functional near-infrared spectroscopy and also EEG studies, all of which are designed to predict relapse in patients as they go through treatment. This is vital for us. It's like having a blood pressure cuff, if you will. We do not have one of them right now. We do not have objective data right now. So having these neuroimaging studies that predict relapse really allows us to get in there and decide what is the best treatment plan and how long someone should stay in treatment. And we need the funding to find the right studies to do and to get funding for studies that may not get funding otherwise. This is incredibly vital research that needs to be done.
Additional funding is always good. More money is always a good thing, especially when you're doing great things like research. And so we definitely need funding for our building, because we need to have the physical infrastructure where we can conduct these projects and conduct them on a larger scale as well. Beyond improving outcomes for our patients here at Caron, where our goal is actually to contribute to knowledge overall, and that way we can make a significant contribution to not only to medical knowledge but to the health of the public.